In today's video, we'll be exploring 10 effective remedies for swollen ankles and feet that you can start using today. Swelling in the feet and ankles can be a common problem affecting people of all ages. But the good news is that there are several remedies that you can try to help alleviate this issue. We are gonna dive into some simple yet powerful solutions that are backed by science and have been proven to work. So let's get started. Number 10. Compression socks. Compression socks are a popular and well-established method for reducing fluid retention in the legs, feet, and ankles. These specialized socks apply graduated pressure to the legs, which promotes better circulation and prevents the buildup of fluid in the lower extremities. They come in a pair and are available in a range of compression levels, including mild, moderate, and firm. The appropriate level of compression will depend on the individual's needs and medical history. It's important to note that different types of swelling may require different approaches. For example, if the swelling is caused by vein problems, then compression stockings may be recommended. On the other hand, if the swelling is caused by poor circulation, then exercise and lifestyle changes may be more beneficial. Before buying compression socks, it is advisable to consult with a qualified medical practitioner to determine the right type and level of compression for you. Research shows that compression socks can be highly effective in reducing swelling in certain populations. A study published in the Journal of Travel Medicine found that wearing compression socks significantly reduced leg swelling and discomfort in airline passengers during long-haul flights. Another study showed that compression stockings were effective in reducing swelling in patients with venous insufficiency. By incorporating compression socks into your daily routine, you can help improve circulation, reduce swelling, and promote overall foot health. Number 9. Massage your legs. Massage is a popular and effective approach to alleviating swelling in the feet and ankles. By massaging your legs, you help activate the lymphatic system, which is responsible for removing excess fluid from the body. This process helps improve circulation and reduce edema in the lower extremities. However, it's important to exercise caution when giving a massage, especially to individuals with diabetes, as they may have fragile tissues due to vascular dysfunction. Take extra care to avoid causing vascular damage or bruising. Research suggests that massage therapy can help reduce swelling in specific populations. A study published in the journal Oncology Nursing Forum found that massage significantly reduced arm swelling and pain in breast cancer survivors with lymphedema. Another study showed that massage therapy improved edema and reduced pain in patients with knee osteoarthritis. Incorporating massage into your routine can not only help with reducing swelling, but also provide relaxation and promote overall well-being. Number 8. Use essential oils. In addition to traditional massage techniques, you can enhance the benefits of your foot massages by incorporating essential oils. These concentrated plant extracts offer various therapeutic properties and can help soothe and relax the feet while reducing swelling and discomfort. When using essential oils for swelling, mix a few drops with a carrier oil like jojoba or coconut oil and apply the mixture to the affected area. You can also add a few drops of essential oil to a warm foot bath for a relaxing and soothing experience. Popular essential oils for reducing swelling include peppermint, lavender, and eucalyptus due to their anti-inflammatory properties. They help improve circulation and reduce swelling in the feet and ankles. However, before using essential oils, it's crucial to consult with a medical practitioner to ensure safety and effectiveness, particularly if you have pre-existing medical conditions or are taking medications. Research indicates that essential oils can aid in reducing swelling and promoting relaxation. A study published in the Journal of Holistic Nursing found that a massage with essential oils significantly reduced pain and swelling in patients with rheumatoid arthritis. Another study showed that inhaling essential oils reduced anxiety and stress in patients undergoing orthopedic surgery. By incorporating essential oils into your foot massage routine, you can enjoy the benefits of these aromatic compounds in reducing swelling and promoting overall foot health. Number 7. Exercise. Regular exercise is an effective strategy for reducing swelling in the feet and ankles. Engaging in physical activity helps stimulate the muscles, which in turn assists in pumping blood and fluids back toward the heart. This action reduces the accumulation of excess fluid in the lower extremities, particularly beneficial for individuals who spend prolonged periods sitting or standing. Walking is a simple yet effective form of exercise that can help reduce swelling by stimulating calf muscles, which serve as a pump to move fluid out of the legs and feet. Other low-impact exercises like yoga, cycling, and swimming can also help reduce swelling without excessive stress on the joints. Maintaining an active lifestyle can help restore circulation and alleviate swelling in the legs and feet. Research demonstrates the effectiveness of exercise in reducing swelling in specific populations. A study published in the Journal of the American Heart Association showed that exercise reduced leg swelling and improved walking distance in patients with heart failure. Another study found that yoga was effective in reducing edema in women with lymphedema. By incorporating regular exercise into your routine, you can improve circulation, reduce swelling, and enhance overall health. Number 6. Herbal remedies. Herbal remedies offer a natural approach to reducing swelling in the feet and ankles. Herbs like cayenne pepper contain compounds that can improve circulation and reduce swelling and discomfort. You can steep cayenne pepper in boiling water for 15 minutes, strain the mixture and drink it twice daily to help alleviate swelling. Similarly, dandelion root tea can help promote urine production, aiding in the removal of excess salt and water from the body and reducing swelling. Other herbs like ginger and turmeric have anti-inflammatory properties that can help reduce swelling and pain. Brewing these herbs into teas or consuming them as supplements can provide relief. Additionally, herbs like horse chestnut and butchery's broom have diuretic properties that can help reduce fluid retention and improve circulation. Always consult with a medical practitioner before using herbs, especially if you have pre-existing conditions or are taking medications. Research suggests that certain herbs can effectively reduce swelling. A study published in the International Journal of Basic Applied and Innovative Research showed that dandelion extract reduced swelling in patients with mild to moderate heart failure. Another study found that a combination of ginger and turmeric reduced knee swelling and improved function in patients with osteoarthritis. Incorporating these herbs into your diet or routine can provide a natural approach to reducing swelling and promoting overall foot health. Number 5. Diet. The foods you eat play a significant role in reducing swelling in the feet and ankles. Consuming a balanced diet rich in vitamins, minerals, and antioxidants can help improve circulation and reduce inflammation. Reducing salt intake is crucial as excess salt can cause fluid retention and worsen swelling. Instead, opt for fresh, whole foods and limit processed foods and sugary drinks, which can contribute to inflammation and fluid retention. Foods like celery, cucumber, and spinach are rich in potassium and magnesium, which can help eliminate excess sodium from the body and reduce swelling. Citrus fruits like oranges and lemons are high in vitamin C, which improves blood flow and reduces inflammation. Fatty fish like salmon and mackerel are rich in omega-3 fatty acids, which reduce inflammation and promote overall health. By adopting a balanced diet and making smart food choices, you can support your body's natural processes and reduce swelling in the feet and ankles. Number 4. Sleep well. Getting enough sleep is essential for maintaining good health and reducing swelling in the feet and ankles. During sleep, your body goes through various restorative processes that help improve circulation and reduce inflammation. Adequate sleep helps promote lymphatic drainage, which is the process of removing excess fluid from the body. It also helps reduce stress levels, which can contribute to fluid retention and swelling. Most adults need 7 to 8 hours of sleep per night to maintain good health. To improve your sleep quality, establish a consistent sleep schedule, create a relaxing bedtime routine, and ensure your bedroom is dark, quiet, and well ventilated. If you experience persistent swelling, consider consulting a healthcare professional to rule out any underlying sleep disorders or medical conditions. By prioritizing sleep, you can support your body's natural healing and restoration processes, potentially reducing swelling and promoting overall foot health. Number 3. Wear proper footwear. The footwear you choose can significantly impact the level of swelling in your feet and ankles. Wearing shoes that are too tight or restrictive can restrict blood flow and worsen swelling. It's essential to choose shoes that fit well and provide adequate support and cushioning. Opt for shoes made from breathable materials like leather or canvas that allow air to circulate and prevent moisture buildup. Avoid high heels or excessively flat shoes as they can affect blood circulation and contribute to swelling. When selecting shoes, ensure they have a wide toe box that allows your toes to spread comfortably and promote proper blood flow. Using orthotic inserts can also help provide additional support and cushioning if needed. By choosing the right footwear, you can minimize swelling and promote better circulation in your feet and ankles. Number 2. Reduce alcohol intake. Excessive alcohol consumption can contribute to swelling in the feet and ankles through several mechanisms. Alcohol can dilate blood vessels, including veins, which can cause fluid to pool in the tissues around your feet and ankles. Additionally, alcohol can impair your liver's ability to produce albumin, a protein that helps maintain fluid balance in your body. When you drink alcohol, your kidneys can also excrete more sodium, which can lead to fluid retention and swelling. To reduce swelling, it's important to monitor your alcohol intake and adhere to recommended guidelines. For healthy adults, this means having up to 2 drinks per day for males and up to 1 drink per day for females. You can also try to identify any triggers that cause you to drink heavily and develop strategies to manage them, such as seeking support groups or therapy. Remember, reducing alcohol intake is not only beneficial for your overall health, but can also help alleviate swelling in your feet and ankles. Number 1. Stay hydrated. Drinking plenty of water is a simple yet effective tip for reducing swelling in the feet and ankles. Staying hydrated helps promote circulation and aids in the removal of excess fluid from the body. When you're dehydrated, your body can become sluggish and the lymphatic system, which is responsible for removing waste and excess fluid, can become impaired. This can lead to fluid buildup and swelling in the feet and ankles. On the other hand, drinking enough water keeps your kidneys functioning optimally, helping them filter toxins and produce urine, which eliminates excess fluid and reduces swelling. It's generally recommended to drink 8 glasses of water per day, but individual needs may vary depending on factors like activity level and climate. To stay hydrated, carry a water bottle with you, set reminders on your phone, or use a hydration tracking app. By making a conscious effort to stay hydrated, you can support your body's natural detoxification and circulation processes, potentially reducing swelling in your feet and ankles.